Good morning. My name is Jose Ollague. I'm a dermatologist and dermatopathologist from Ecuador. Um, okay. I've titled this lecture, The More the Better. And this is because I truly believe that training more dermatologists is a way that in Ecuador we can improve the access of dermatological health care. And I'll explain you why in a minute. Ecuador is a small country in South America, but we have 18 million people living in there. They're mainly concentrated in 5 states. In Ecuador, we have 450 dermatologists practicing, which represents 2.5 per every 100,000 Ecuadorians. Now, in a recent article, it was estimated that the number needed to guarantee an adequate care in dermatology was 4 per every 100,000 inhabitants. We can see that we have a clear deficit. At the same time, 80% of our dermatologists are focused mainly in private practice. The average cost of clinical visit is between $40 to $50, and the minimum wage salary is $425 US dollars. So you can imagine a visit, it's almost an eighth of their salary. Now, before 2010, when I left the country for training in the US, there were 4 training programs in my country. They were graduating between 6 to 8 new dermatology residents per year. That's about 30 residents per year. After I came back, only 1 training program remained left. And currently they're graduating 12 residents per year. That has left us, between the whole nation, as a dermatology population of 2% among all the specialties in the country. This is because of this, the project was starting a new residency program to get new residents and more dermatologists to the country. Now, we designed a project of 4 medical facilities, general hospitals where I practice at, where they have multiple rotations, a pediatric hospital, a National Cancer Center, which is going to be part of it with dermoscopy and most surgery rotations, and a private clinic that will help us to provide them with the laser rotations and cosmetic rotations too. We have the honor to have on board 9 faculties that will cover all these subspecialties. It will be a 3-year training program, and we hopefully plan to graduate between 4 to 6 residents per year. At the same time, we've been talking and engaging with other people to try to make collaborations. Within the country, we've established conversations to start national missions with the Galapagos Islands, who don't have any dermatologists. And I've been talking to Marlis about the idea of helping her with a telehealth program in Puerto del Carmen, which we would like to incorporate as part of our residency. At the same time, we've talked to several residence training programs in the US and in Brazil, so we can create an exchange program for residents and physicians to lecture. What are the goals for our project? Well, the main one is to provide high-quality care, training good dermatologists, providing an integral training in all the subspecialties, giving them gradual increments of responsibility, but also helping them develop other skills than just the clinical dermatological skills, personal skills, and leadership skills. We would love to give them exposure to a better medical health care so they can bring back new ideas, so help us to develop the dermatological field in Ecuador. At the same time, we don't have many subspecialties, so we would like to encourage that in our residents, as well as encourage to provide dermatological care to underserved areas which currently is not being done effectively. With our projections, we think we can reduce the gap that we have in our country in approximately 30 years, and we can help that way to improve the dermatological healthcare access at the same time. Now, the current scenario, our training program is under revision and its approval is pending. Hopefully, by the end of this year, we can launch our program. And with our next steps is to call for applications and formalize all this ventures that we have with international collaborations and exchange programs, as well as the national missions. We hope that our program can start this year and help our community very soon. Thank you very much.
And I just want to call out one thing that Jose said. That was you guys have all done such an incredible job. Is that some of the names he's mentioning are other mentees in his class. And I think what's so cool is that even without us, they have their own WhatsApp group. They've been on email. They've written papers together this year. The group has really taken off and has their own kind of community and connections. And I'm so proud of all of them. So he was mentioning some of our other mentees that he's working with and starting projects with. So to me, that is like one of the coolest things, and it gives me total body tingles. So thank you for bringing that up.